Welcome back to Cycle Wisdom, where we empower women to restore natural menstrual cycles to improve health and promote fertility. I'm your host, Dr. Monica Minger, and I'm so glad you're listening today. On today's episode, we're going to be talking about a difficult topic, miscarriage, or early pregnancy loss prior to 20 weeks gestation. We will discuss some of the statistics regarding miscarriage, as well as potential causes. I will also give an overview of appropriate evaluation for a miscarriage, as well as some potential treatments or monitoring that can be done to try and prevent future problems. So, as always, I'd like to start out today with a patient story, and we'll call our patient Carla. Now, she and her husband came to see me after having 2 miscarriages in the past year. She initially had a difficult time with getting pregnant, and unfortunately lost that baby when she was about 7 weeks along. They still had a strong desire to start a family, and so a few months later were able to get pregnant again, but unfortunately miscarried again at about 8 weeks. So one of the things they had been told by their OB doctor was that there really wasn't anything to do for them unless they had 3 or more miscarriages, and so they were told to just go home and try to get pregnant again. Carla and her husband were already heartbroken from their 2 miscarriages and couldn't bear the thought of another early pregnancy loss. In my opinion, 1 miscarriage is already so much to process, and the possibility that we can help to prevent any additional heartache and loss gives me a reason to evaluate further. So we started working with Carla and began evaluation, which included blood work, charting of her cycles, and additional evaluation to see if there were any other underlying causes of her miscarriages. Now, what we ended up finding out in her case is that Carla actually had an autoimmune blood clotting disorder, which made her more likely to have clots when she was pregnant. Even though she never had a large blood clot in her leg or her lungs, the fact that she was pregnant, in addition to this autoimmune clotting disorder, was likely increasing her chances of having small clots where the baby was trying to grow, which could have caused the miscarriages. Now, in Carla's case, the rest of her hormone panel looked normal, as well as her charting, and she didn't require any other intervention. Her treatment course was actually fairly simple, and I recommended that in addition to her prenatal vitamin, that she would start a baby aspirin daily, as well as have additional evaluation with a hematologist who is a blood specialist. A couple months later, she was able to achieve pregnancy again and went on to have a full-term, healthy pregnancy without any complications. Now, I'm certainly not advocating that every woman should be on a baby aspirin in order to prevent miscarriages, but in Carla's case, it was important that we found out the underlying cause of her miscarriages, and we were able to tailor treatment appropriately for what she needed to treat the underlying cause. So let's talk a little bit about how common miscarriages are and how they're defined. So any pregnancy loss prior to 20 weeks is considered to be a miscarriage, regardless of the cause. If a pregnancy ends in the loss of the baby after 20 weeks, it is called a stillbirth. Unfortunately, miscarriages can be quite common, and estimates are that anywhere between 10 to 30% of pregnancies will end in miscarriage. The majority of these, around 80%, occur within the first trimester, which is anything prior to 12 weeks. If a woman has 2 miscarriages in a row, it's considered a recurrent miscarriage. And if there are 3 or more miscarriages in a row, the chance of additional miscarriages increases dramatically, up to 40 to 50%. As we often see an underlying cause for that recurrent loss. Now, the causes of miscarriage are incredibly vast, and it can be quite challenging to know exactly what caused each miscarriage, especially if there was not additional testing completed as the miscarriage occurred. Now, with that being said, estimates are that approximately 60 to 70% of miscarriages are caused by some type of chromosomal abnormality. Now, whether that's a chromosome that they received from one of their parents or a translocation or gene mutation that occurred after fertilization happened. Another thing that is always worth evaluating is if there are any anatomic causes with the mother that may cause troubles with the baby growing. For example, if the mother has what's called a septate uterus or an arcuate uterus, which means that the uterus itself is formed differently, or sometimes can have a division of tissue in the middle of the uterus. In these cases, as the baby tries to grow, it may not have the space it needs in order to be able to grow and get good blood supply. Other causes of uterine anatomy issues can include scar tissue in the uterus or fibroids, which are benign masses that can be in the inner part or even grow into the muscle wall of the uterus, which can cause troubles with implantation of the placenta. Some women also deal with troubles with their cervix staying closed throughout pregnancy, and this can cause later-term miscarriages or stillbirths. Another reason for miscarriages that we talk about trying to prevent is different types of infections. Sexually transmitted infections can be incredibly challenging in pregnancy and can cause miscarriages. We also talk a lot with women about avoiding certain foods because of their increased risk of food poisoning. There are also other viruses out there, including parvovirus and cytomegalovirus, that can increase your risk for miscarriage. One of the more preventable causes of miscarriage can also be a progesterone deficiency. I specifically check progesterone levels throughout early pregnancy on nearly all of our clients who have been treated for irregular menstrual cycles prior to pregnancy, as this can be a risk factor for miscarriage or preterm births. We have tracked many women throughout their pregnancy and find that some women require support with their progesterone levels, as progesterone is an incredibly important hormone, especially in early pregnancy, for the development of the placenta. Other independent risk factors for miscarriage would be in women who are either smoking, drinking alcohol, or using any illicit drugs. Unfortunately, women who have chemical exposures, whether that's through their environment or whether that's in their workplace with things like lead, arsenic, or other heavy metals, that can be really toxic as well. Personal risk factors for increased rates of miscarriage also include any woman over the age of 35. Now, it's presumed that this is secondary to an increase in chromosomal abnormalities, but we also see a drop-off in luteal phase progesterone levels after this age. And so certainly this is a cause that can be evaluated, followed, and treated appropriately. The final category I would mention that increases your risk of miscarriage would be things that are personal to a woman's medical history. So any woman with any type of autoimmune disorder, including things like thyroid dysfunction or diabetes, can increase your risk. Women who have had irregular menstrual cycles, especially polycystic ovary syndrome, can also be at increased risk for miscarriage. Other general medical conditions like high blood pressure, certain medications, kidney disease, heart disease, or women who are either very overweight or very underweight, as well as women who are under increased physical or emotional stress, all of these things can increase your risk for miscarriage. One of the most important things to pay attention to beyond just the physical causes when I evaluate women who have had a miscarriage is to evaluate further what's going on with her menstrual cycles. It's always important for me to take a look at her charting and see what's naturally been going on with the cycles, because there are often biomarkers that I see that may indicate hormonal dysfunction or other things that may be playing a role and put someone at increased risk for miscarriage. One of the most common things that I see when we look back in women who have had a miscarriage is that they have had a shortened luteal phase. And again, that's the time from after you ovulate until your next menstrual cycle begins. Now, from a hormone standpoint, this oftentimes will correlate with low progesterone levels, which can increase your risk for a miscarriage. So if you get pregnant and your progesterone levels are already very low, and now you try to sustain a pregnancy, the placenta has to work incredibly hard to try and get enough progesterone produced in order to be able to support that growing life fairly quickly from the start. If your levels are too low and the body is unable to increase the levels, it can end in a miscarriage. So evaluating the charting can be incredibly insightful to help give a clue as to if something might be going on that would necessitate early intervention. Other things that I always evaluate when I'm working with people who have had a miscarriage is an extensive blood work panel. Typically, this will include looking for things like autoimmune disease, but also looking for things like those clotting disorders that can cause troubles and sometimes require additional evaluation and treatment. Equally as important to evaluating the physical side of miscarriage is to have an awareness of the importance of talking about the emotional stress of a miscarriage. Every woman and every couple handles a miscarriage differently. Some people go on through life and don't really think much about it. Others are incredibly affected by a miscarriage, whether that's seen through increased depression or anxiety, or even with some people, depending upon how things unfold, can deal with post-traumatic stress syndrome from their pregnancy loss or the medical interventions that happened after their miscarriage. When I work with families who have suffered a loss, that's something that is incredibly important to me, to be able to address and manage all aspects of that pregnancy loss. When working with a couple who has gone through a miscarriage, I often get asked, when can we try again? Typically, the recommendations are that you wait for one normal menstrual cycle to resume, but beyond that, it's more about emotionally when you're in an okay place to be able to have another pregnancy, as well as to be able to deal with everything if there is another recurrence of miscarriage. There are actually some studies that have been done in the past few years that show there is an increased chance of successful pregnancy within the first 6 months after a miscarriage. So we no longer say that you're required to wait a certain amount of time before you would try again. When it comes to treating or preventing miscarriage, it really depends upon if there are any underlying causes we determined when we went through that full evaluation process. Certainly, treating any underlying causes that may have been found, specifically in regards to underlying medical conditions or hormonal imbalances, is incredibly important. I always talk with the people that I work with that if they have underlying menstrual cycle abnormalities or conditions, like PCOS or PMS, or women that we've been treating for other menstrual cycle irregularities, that it's fairly likely that they will need some sort of hormonal progesterone support throughout their pregnancy in order to try and prevent miscarriage. Now, if you have a history of a pregnancy loss and are looking for further evaluation, I would welcome the opportunity to talk more with you about appropriate evaluation and possible interventions to prevent additional miscarriages and what that could look like for you. If you're ready to work with our elite team of healthcare professionals, go to our website, radiantclinic.com, where you can schedule a free discovery call with me to learn more about our package-based pricing for healthcare. We customize your treatment plan and include options to access a hormone coach, fertility awareness charting experts, a registered dietitian, a fertility acupuncture specialist, a health coach, and of course, all the medical care you need from me as a board-certified physician. We are currently able to see people for in-person appointments in the Cedar Rapids area, or can arrange for a telehealth visit if you live in the state of Iowa. Thank you so much for listening to this episode. Please share this podcast with someone in your life who would benefit from our services. Remember to subscribe to this podcast for more empowering content. I sincerely appreciate your support, and I look forward to sharing more with you on our next episode of Cycle Wisdom.